This is our second annual Parent and Family Support Meeting put on by the Myocarditis Foundation. We're really appreciative of all of you being here today. We hope that we can answer a lot of questions about the disease, about what the foundation does, how we can support you, introduce you to some of the research that we've been funding. If you have any questions, feel free to ask. After presentations, we also have an open question and answer session with Dr. Cooper and Dr. Price. And so at that time, they will be able to answer a lot of your questions because question and answer sessions after the talks will be kind of short, just so we can stay on schedule. All right, so I'm going to just talk a little bit about the foundation because some of you are brand new, you haven't heard of us before. So this should kind of just be an introduction about what we do, who we are, some of the things that we've been working on in the past couple of years. I got it, it works. You see that okay? All right, so the Myocarditis Foundation, simply put, is a nonprofit organization dedicated to providing information and support related to the causes, symptoms, and diagnoses and treatments of myocarditis and sudden death. So Candace Moose, Dr. Leslie Cooper, and Dr. Mario Dang, they were the founders of the Myocarditis Foundation, and it is through their hard work and dedication that the Myocarditis Foundation has been able to spread awareness, fund research, and save lives these past 9 years. So Candace Moose is a giant cell myocarditis survivor, and is only through her miraculous care of her then Dr. Mario Dang and the innovative work of Dr. Leslie Cooper that she was able to make it to transplant and now lives a joyous life with her husband, children, grandchildren, and the many friends and family that she has. In 2005, after her recovery, Candace called up Dr. Cooper and asked him what she could do to thank him for quite literally saving her life. His response was simple. He wanted to start a foundation where people could learn about the disease and talk with others who had been affected. He never dreamed the Myocarditis Foundation would grow to the size it is today and have the far-reaching accomplishments it has achieved, especially not in just 9 short years. Since its inception in 2005, the Myocarditis Foundation has been committed to its 3-pronged mission of patient and family support, spreading awareness, and funding research. It is all in an effort to save lives from the disease myocarditis. The Myocarditis Foundation works every day to learn more about this disease and to bring wider awareness of myocarditis to both the general public and the medical community. It is only through advanced awareness efforts that the subtle signs and symptoms can be recognized and proper diagnosis and treatments can be prescribed, saving lives from this often devastating disease. So the Myocarditis Foundation has made awareness and education its topmost priority because we know it can save lives. Myocarditis is often a silent killer. Many cases of myocarditis are asymptomatic or the symptoms are simply that of a common cold. Think back to all the news stories of those athletes and young adults collapsing on the football field, on the basketball court, or after completing a race or marathon. Many of those deaths were attributed to myocarditis, but there were no alarming signs or warning symptoms for the patients or their families. This is why education and research are critical. Then we come to the cases of those patients and families who sought medical attention, but their case of myocarditis was misdiagnosed or undiagnosed, and the patient died just hours after leaving the hospital or clinic, or passed away right there in the ER. This is where awareness can really save lives. If the family physicians and ER staff have the diagnosis of myocarditis in the back of their minds, how many lives can be saved? But keep in mind, even with a proper diagnosis, sometimes it's not enough. This is why the Myocarditis Foundation has created an extensive awareness program, but not only for the general public, but for medical professionals as well. The Myocarditis Foundation attends medical conferences around the world talking about myocarditis, holding symposiums, and staffing informational booths. We also have a variety of services available to physicians, including our adult and pediatric diagnostic brochures. And in 2014, we have already held a myocarditis symposium in Melbourne, Australia, at the World Heart Federation's meeting, talked with hundreds of physicians about myocarditis at the Asian Pacific Congress of Heart Failure, and have collaborated with the state-of-the-art myocarditis research lab at Samsung Hospital in Seoul, South Korea. Not to mention the many different myocarditis talks Dr. Cooper gives at medical facilities across the U.S. and different research, across the U.S., and we are only halfway through the year. It seems that each year we are invited to more and more medical meetings, each one seeking the most up-to-date information about myocarditis treatments and research. It is because of the many fundraisers and awareness events that the Myocarditis Foundation and the families who support us hold that the word is spreading and more professionals are seeking our services. So thank you to all of you for making this possible. In 2013, over 30 awareness events and fundraisers were held by families around the world who had been affected by this disease. That means that 30 more communities now know the effects of myocarditis, know to watch for the very subtle warning signs it can present, and most importantly, 30 more ER and family physicians now have myocarditis in the back of their mind when treating patients. Just think of the many lives we can save through ongoing awareness programs. The Myocarditis Foundation also prides itself on its outstanding scientific research program. In fact, the Myocarditis Foundation is the only organization that awards 100% of its research grants to myocarditis-specific research. Since 2006, it has awarded 13 research grants to young physicians across North America, totaling over $400,000. Many of these young physicians have gone on to publishing stories in prominent medical journals highlighting their myocarditis research and subsequent research projects. The Myocarditis Foundation's research program is also very different from many other nonprofit research programs in the fact that it adopts each of its researchers into a robust mentoring program. Let's face it, the number of physicians and medical experts who specialize in myocarditis is quite small. By nurturing these young researchers, the Myocarditis Foundation is securing a successful future for the field of myocarditis experts and researchers by ensuring it will continually be filled with passionate and knowledgeable individuals dedicated to finding better ways to diagnose, treat, and ultimately prevent myocarditis from taking more lives. While the Myocarditis Foundation has been incredibly successful in its awareness and research programs, it takes a great deal of money to fund these things. This is where we need your help. So, myocarditis is a very hard disease to raise money for because of 4 distinct challenges. And some of this came from Candace's talk last year, so I apologize if some of you have heard this little part before, but it's very important. So the first challenge is myocarditis is thought of a rare disease. While it is true that most people have never heard of myocarditis until after it affects them, the truth is that there are thousands of people who have had myocarditis or have passed away due to myocarditis, but it was never diagnosed or determined as myocarditis. Myocarditis can mask itself as another disease in the milder cases, will be determined as cardiomyopathy, which can be an after effect of myocarditis in many cases, or an autopsy was never performed or cause of death was never determined. The second challenge we face when trying to fundraise for this disease is myocarditis is really many different diseases kind of all rolled into one. So lymphocytic myocarditis is primarily viral in nature, especially in children, and while some of the viruses have names, others are fleeting in nature. Then there's giant cell myocarditis, which is much rarer and is autoimmune in nature. And once we start evaluating myocarditis in developing countries, a whole host of causes become apparent, such as beetle bites, parasitic worms, sexually transmitted diseases, fungal or other bacterial and viral infections. It is virtually impossible to estimate the incidence of myocarditis internationally. And the third challenge is lack of name recognition, which I know many of you guys know firsthand about. Myocarditis is also known as inflammatory heart disease, but in the media it can be identified as lots of other conditions. Families find themselves having to explain over and over a disease which sometimes 11 years later they still can't even quite fully understand. Myocarditis is hard to say, it's difficult to describe, it's unheard of, it's difficult to even spell, so therefore it's rarely used when reporting in cases in the media, hence why we have such a robust awareness program and your fundraising is so vital in your own communities. The more you can get the name out, the more name recognition we can spread and create. And so challenge number 4 is confusion about what myocarditis actually is, which is why many of you guys are here today. So myocarditis is so difficult to understand and it leads to so many questions. How could this disease have happened? Why didn't I see it coming? How could it have progressed so quickly from no or only very mild symptoms to an extreme sickness, transplantation, or even death? And worse than that, many are left feeling guilty because they thought they had missed something. And your answer is, you didn't miss anything. Candace Moose was a coronary critical care nurse, and she didn't ever suspect heart failure in herself, much less myocarditis. Myocarditis comes out of the blue. We don't expect it because we are healthy to begin with. We are taught in our culture that the disease progresses from mild to life-threatening over time, and that if we change our behavior, we can turn it around. We expect diseases to be preventable, treatable, and curable. Myocarditis is not preventable or curable, but in some cases it is treatable. So why is it important to fund myocarditis research and the Myocarditis Foundation? Essentially, it's because we are the only organization who is solely focused on saving lives from this disease, myocarditis. Our board of directors volunteered their time to develop missions and goals to find ways to spread awareness, provide support to families, and above all, fund myocarditis research. Our medical advisory board chooses our grants based not only of their achievability, but on their ability to advance science of myocarditis. In other words, are they studying something we need to know? In our culture, business corporations and grant committees want to see achievable results with their grants. It is very difficult to make them understand that there is value in funding research or supporting an organization like ours that will likely not see results in our lifetime. I'll leave you today with a message from Candace Moose, President and founder of the Myocarditis Foundation. So Candace says, I have made this disease my personal mission in life. This disease almost destroyed me and my family as well, a disease even I had never heard of. Shortly thereafter, in my recovery, Dr. Cooper and I started this foundation only to discover that no matter how much I was hurt by this disease, that something far worse than I experienced could and did happen. Myocarditis steals children. Far worse than being sick yourself is envisioning or experiencing the death of your child or loved one of any age. There exists no more compelling reason to raise money for this disease than to fund research so that no one ever again suffers like you have as a result of this disease. So thank you. So do you have any questions about what the foundation is, anything that we do, anything that we've been working on, anything like that?
I just have one question, and it's going to be probably a question that I'm going to have for my whole life, is do they know if there's a correlation with genetics or hereditary or anything like that? If a child, are their siblings possible? We don't know.
No.
I'll touch on it. As of today, in people, there's no genetic link. They're strongly genetic in animals, and it's probably true in people as well, but we haven't figured it out yet. We're actively working on it. I think 5 years from now, the answer will be yes sometimes, but it's complicated.